An important exocrine gland is present in the oral cavity called as the salivary glands. So we know that there are three pairs. One is parotid, para plus otic, meaning by the side of the ear, and then we have something called as a sublingual and a submandibular. Mumps is an inflammation of the salivary glands. So when we take this parotid, it is in two lobes. One is the lateral lobe and then the deep lobe. So the lateral lobe is a superficial lobe. Here what happens, a nerve that passes by the salivary gland, which is a facial nerve. Facial nerve passes via the salivary gland. If there is a tumor of the parotid gland or the salivary gland, what the physician is going to do, he is going to excise it. Here you need to know, is it the excision of the parotid or the submandibular, because based on the type of the gland, the codes are going to differ. Now, when the physician is going to remove a tumor on this lateral lobe, we have a specific code. You need to know whether the physician is going to preserve the facial nerve. He is going to cut it, keep it aside and safeguard it. There is one set of code. Or if the physician is going to dissect the facial nerve, we'll have to report a code named as sacrifice of the facial nerve. And you know, since it is an exocrine gland, the secretions of the salivary gland, which is the saliva, passes via the duct called as a salivary duct. Now, in rare cases, there might be formation of stones in the salivary gland called as Sialolithiasis, in which case the physician inserts a needle into it and he tries to remove or manipulate the calculus. So, this is called a Sialolithotomy.